restless leg syndrome,
Parkinson's disease,
Parkinsonism,
Tourette syndrome,
Huntington's disease,
ataxia,
tardive dyskinesia,
chorea,
essential tremor,
Wilson disease,
progressive supranuclear palsy,
dementia with Lewy bodies,
stereotype is
multiple system atrophy,
dystonia.
Myoclonus is a movement disorder.
Is a movement disorder.
is an important movement disorder.
A movement disorder, by definition, is a neurologic condition in which there are abnormal movements or abnormal coordination, but the muscular strength is actually retained.
There is a very broad spectrum of the way these patients can present.
I was a clinician at that time. I was doing the work in the lab, but also running this trial in L-DOPA. I became interested in other movement disorders, but we didn't have a name for movement disorders. When Dr. Rowland asked me to start a Parkinson clinic shortly after I joined, I told him, because we already knew about dyskinesia and DOPA, that there was a connection between abnormal movements and Parkinson's, and the DOPA makes a Parkinson akinetic person into a hyperkinetic person. So I told Bud, look, I would run the clinic, but I don't want to call it Parkinson Clinic. We had to come up with a name for the clinic, and we sat just like we're sitting now, next to each other, and we're chatting about them, we're trying to come up with names, and Bud came up with the idea, well, why don't we just call it movement disorders? I said, that's it, movement disorders. We called it movement disorders, and so we started the movement disorder clinic.
This situation is so complex that it really requires a movement disorder expert.
Movement disorders specialists are trained to continue to adjust the treatment.
And also to walk through and be a partner with the patient.
Sometimes we need a teamwork for management with the patient.
It's really important to emphasize the role of allied health physiotherapy, occupational therapy, speech.
Our aim is to keep the quality of life at a high level.
They should not lose hope.
There have never been as many trials ongoing in this disorder as are currently.
There are several new drugs that are now available.
If you have symptoms, we encourage you to see a movement disorder specialist.
the vast majority of patients can achieve their full potential.